My fellow Americans, distinguished guests, and honorable representatives, and Mr. President, thank you for your hard work and your dedication. The 50 million individuals without health insurance are not just Americans. They're our friends, our neighbors, and our relatives. Just as the majority of us have no idea what it's like to live with a deadly disease or injury, we also cannot imagine what it's like to live through such suffering without insurance. We must stop using our mouths to argue about and fight about which souls will be covered. We must use our heads and put our hearts together and find the funds to pay for their care. Mr. President, in a recent radio address, you stated that the only way to dig our way out of this rut we are in is through innovation. I wish for you in Congress to consider the following policy change. Anyone that has questions or comments, or if you think it will not work, please tell me by leaving a comment at whitecollargreenspace.blogspot.com or emailing me at whitecollargreenspacegu@hotmail.com. We all know that bureaucracy moves slowly, but I believe that our government employees and management are responsive and dynamic, and they're able to implement this very quickly. The federal government alone leases about 1/2 billion square feet of office space. Most white-collar workers work an 8-hour day, even though most buildings are open for 12 hours, from 6 a.m. to 6 p.m. Overall, these expensive facilities sit unused 60 to 70% of the time. By opening the buildings an additional 4 hours or 5 hours, we could schedule 2 shifts of white-collar workers. The government could cut the cost of overhead for each white-collar worker by as much as 50%. Half as much infrastructure, half as much office space, half as much computers and supplies. With the annual overhead for each of our 2 million federal workers approaching $50,000 a year, the potential savings could be between $25 and $50 billion every year. By extending this paradigm change to the independent contractors and to the state office workers, where the feds pay a substantial share of the expenses, the savings could be between $50 and $100 billion per year. This could be the seed money to help cover the currently uninsured. This is doable because most office work is now electronic. Our agencies are customer oriented, and they already try to offer services as close to 24/7 as possible by the use of excellent internet sites and 800 number services. Immediate budget savings would come by canceling leases and postponing new construction until full analysis could be done. Henry Ford applied the advantages of mass production and interchangeable parts to build a car that everyone in America can afford. Let's build a health insurance program that everyone can afford. In this new century, we must apply what we learned during the Industrial Revolution. We must abandon the 9-to-5 paradigm for white-collar workers, as they are the new assembly lines. We must manage efficiently, stop all wasteful practices. The challenge to make this simple paradigm shift comes not from the fact that we are Americans, or that we are Republicans or Democrats, liberals or conservatives, religious or unreligious. It comes from the fact that we are all part of a civilized society. I stand ready and willing to answer any questions, discuss any concern, and to help any way I can. Americans must never cease to persevere, because we can do it. Labor Day is near. Recently, I talked to a 62-year-old GM employee who had worked there 32 years. He was blue collar. He doesn't have health insurance in his retirement. He was not part of the union. I'm Tim Albright from West Branch, Michigan. I represent no specific group, organization, or corporation. Thank you for listening. Stay tuned for another episode real soon. Thanks.